If Dr. Oz has you saying,
What the heck?
What the heck?
What the heck?
he's taking you back to basics. What to eat,
I'm gonna give you 3 options.
what to take.
Here's my rule of thumb.
1 full hour of Dr. Oz's new simple advice.
I want to make it clear to you and everybody else.
Next.
Have I left you feeling utterly confused? So much so that you're begging the question, Dr. Oz, what the heck? You reached out to us on Facebook, tweeted us on Twitter, sent us hundreds of emails, and we heard you loud and clear.
Dr. Oz, I tried every diet you suggested. The belly blast diet, the blood type diet, the lazy girl diet. Dr. Oz, what the heck?
No fat, low fat, good fat, bad fat.
If I eat one more psyllium husk, I think I'll explode.
High carbs, no carbs, low carb.
Fish oil, chia seeds, green tea extract. I'm so confused.
Dr. Oz, what the heck?
What the heck?
Dr. Oz, what the heck?
So here's the surprising thing. These aren't the only people griping about my show. Even my colleagues have something to say.
My patients know vitamins A, B, and C better than my daughter knows her alphabet. What the heck, Dr. Oz?
Fiber, fiber, fiber. That's all my patients want to talk about. What the heck, Dr. Oz?
Dr. Oz, so many of my patients refuse to step foot on my scale because you say waist circumference is the only number that should matter. Dr. Oz, what the heck?
Some of my patients come in asking to be checked for ovarian cancer. They know the symptoms and everything. In fact, they know more than some medical professionals. What the heck, Dr. Oz?
My patients know way more about oral cancer today than they used to, and they're all insisting on a screening with a little blue light. Dr. Oz, what the heck?
Everyone is coming in slathered in sea buckthorn. Dr. Oz, what the heck?
Dermatologist, Dr. Elizabeth Tanzi, gastroenterologist, Dr. Roshini Raj, and gynecologist, Dr. Evelyn Minaya, are all here today. Dr. Tanzi, what the heck did I do?
Dr. Oz, I'm a huge fan of the show, but I have to tell you, I can't tell you how many patients I have coming in now asking me to check their moles because after watching your show, they think they have a third nipple.
A third nipple?
Yes, a third nipple, and it's driving me a little crazy.
We didn't talk about third nipples. We had a woman who had 9 of them, actually. But let me ask you, isn't it a good thing to have people come visit you to figure out if these moles that they've got in their bodies are normal or not?
Well, actually, it seems to increase people's awareness of their moles, and I've been doing more skin exams because of it, and I've actually found a couple of precancerous moles that otherwise would have gone unnoticed.
So I understand you've got one of your patients here today who's an example of that. Am I correct in that?
Yes, I do. I have Ashley is here today.
Hi, Ashley.
Hello.
So did you have an extra nipple?
I did not have an extra nipple. I did have an embarrassing lesion in the area. And after seeing your show the other week, I did, being a hypochondriac, freak out a little bit and think I may have had a third nipple. So I went to Dr. Tanzi, and in my full body skin exam, it turns out I don't, but I did have another mole that needed to be further looked at.
Actually, I mean, in fairness, that's why I do the show. I do it to make you smart patients. So you're willing to push and ask and probe and peck to get the truth. Because I know you've got the wisdom there somewhere. You just sort of bring it to the forefront.
Right.
So what did you find, Dr. Tanzi?
So with a full skin exam, I was taking a look at her back, and she had an atypical or dysplastic mole that could be precancerous. In this particular mole, I was concerned about it because it was 2 different colors. There's dark brown and light brown, and the borders were irregular, so it had to go.
Yeah. So, Ashley, are you happy that you saw the show?
Of course. I mean, it has saved my life.
Well, it might have. You never know.
You could have. It's possible.
It is possible. And look, those are the kinds of moles that I always find so tragic when they do change into melanomas. So thanks for getting your extra nipple checked out and confirming that it's not there. So, Dr. Rosh. You seem so mild-mannered all the time when you're out here. Why have I annoyed you?
Well, I don't want to say annoyed, but you definitely have brought a very interesting situation into my world. So you have made America much more aware of their poop. I mean, let's face it, thanks to you, dinner table conversation, cocktail party conversation, everyone's talking about their poop. And as a gastroenterologist, I think that's a good thing. I think people really should be aware of what's coming out the other end. But sometimes now, Dr. Oz, people are actually showing me pictures on their smartphone.
Is that right?
Of their bowel movements. Yes, and I feel like, you know, outside the confines of my office, I'm not sure I really want to be looking at that. So, you know, it could be a little bit of an issue.
So how do you handle that when someone surprises you with a picture of their poop?
With a picture of their poop. Well, I do tell them that it is a good thing to be aware of what the normal shape, consistency, all of those things are. And I actually developed something called a poop log, which people who are concerned can actually keep a record of the shape, the size, color changes, whether they're having any.
Oh, there it is. Oh, I love
we have it right up here.
But I think that poop chart's really clever.
Yeah,
you have
I think it
little
could be
pictures of what
helpful.
they could look like.
Exactly. What's normal, what's not normal, and information.
Anyway, I'm going to put that poop chart, if it's okay.
Yes.
Up on DrOz.com.
That would be great.
You can use that from now on to chronicle your poops. But you have one thing on that list that I love.
Yeah.
You have the foods to eat next to the poops.
Right.
So you can correlate the two.
Absolutely.
Which I think is of
What
value.
you eat can really change the shape, the color, the size. So write down that information as
Can
well.
you imagine how many lives we could save if people looked before they flushed?
Yeah, absolutely. I honestly.
I mean, it'd just be fantastic.
In all seriousness, I think you really have done that already, because in all seriousness, almost on a daily basis, someone comes into my office because they saw your show. So thank you for doing that.
Thank
I
you,
do
Dr.
appreciate
Raj.
that.
So, Dr. Minaya, what the heck have I done to you?
You know, I love you, Dr. Oz, but if one more person comes into my office asking me, Dr. Minaya, is my vagina going to come out, especially when you tell them to have sex 3 times a week? Oi. And it's great because I want them to be, very much aware of their bodies, because it is important. And just like you that use a smartphone, I also get smartphone things in there.
You're kidding
pictures
me.
of that. I am not lying to you. And they do it, which is fantastic, because I want women to know, to touch, to ask about your bodies.
So is that what you tell them?
Absolutely.
Touch yourself.
Yes, touch yourself. Touch yourself. No, but you know what? It's about re-educating. Kegel exercises. You know, things. First of all, go over the anatomy. You know, most women don't even know. I have mirrors in each one of my rooms. I show them, and then what you can do about it.
Let me just show everyone an animation, because I think it'll help demonstrate what you're looking at with those mirrors.
Yes.
And I do want to come back to an action step, because I know that's a big issue for a lot of women.
Yes.
So this is an animation of what your pelvis area looks like. And the part of the puzzle that we're trying to solve for is, if your reproductive organs, the bladder, but there are all these big muscles, lots of muscles. They're strapping around and they're rolling around. They're there to support the bottom of your pelvis. But when they sag, which sometimes if you've had kids as you get older, that sagging leads to a prolapse. So the key is to do exercises, things like Kegel exercise that prevent the sagging that happens here, but lifts the pelvic floor up. Because if you do that, you can actually lift the uterus back up. You can shift the way your rectum is shaped, pull the bladder back up again, pull all these things that are supposed to be where they are in the right place again. So, Dr. Minaya, the big question, and I face this all the time, is how do you get women to do the right kinds of Kegel exercises? Something we talk about all the time, but really be clear about this.
Yeah,
and
I'm
if you
going
need
to be
to,
clear.
graphic about how this should be done.
Yes, and I'm going to be extremely graphic. The most important thing is, it's just like trying to stop your urination. So you hold it and then you let it go. You can do it sitting. It's much better if you're standing. Everybody always asks me, Dr. Minaya, how do I know that I'm doing it correctly? You can place your finger in the vagina, and as long as you can tighten it really tight, that's how you know.
So you put your finger in there?
You put your finger in there. You're allowed to touch it. Trust me. Okay? And that's what I'm saying, that most people are like, ew, I'm not going to do that. Well, I have another suggestion for you. You could put a tampon in. You know that there is a string. You can mark the string with a black marker, and then you can see actually the tampon going up and down as you're doing your exercises. And that is what... I am very clever.
Yes.
And
Resourceful.
Yes, resourceful. You do 3 times a day. I usually tell you breakfast, lunch, and dinner. 3 sets of 10.
3 sets of 10.
3 sets of 10.
And how long do you squeeze each time you do it?
You try to hold it for about, if you can do it 30 seconds, but 45 to 60 seconds, if you can.
Oh,
it's a long time. It's a long time. And you know, if you're doing it correctly, you actually get a soreness, believe it or not. If that's not working, so you do that for a month, let's say, for example, you should feel some kind of improvement, some. If that is not going to work, then you do advanced Kegels. Everybody stand up. I'm going to show you.
What the heck, Dr. Minaya?
I know. What the heck? This is payback. Okay, so you cross your legs, okay, and you really squeeze the vagina. Well,
equivalent.
Be careful. Your pretend vagina. Okay, and you just let it go. Squeeze and let it go. Squeeze. And why cross like that? Because you're actually using a lot of your core. And it's really your core muscles. It's also that, exactly what Dr. Oz had explained, all those muscles that really hold up the bladder and the uterus and also give support to the rectum.
So again, you squeeze for 30 seconds
yes.
or 60
Try
seconds?
To hold it. Try to hold it, hold it, hold it, hold it, hold it, and then you're
I'm sorry, is a set going like this? Or is it one time for 30 seconds and then relax?
No. It's 1 and 2 and 3 and 4 and, okay?
Oh, my back's hurting me.
Yeah, exactly. The back is hurting you already. And think about what women go through, right? And
that's
like
very
labor.
doable.
Yeah, it's very doable, especially the tampon.
Thank you for confiding your biggest complaints about me.
Yes, exactly.